We were to the point where we both turned 50 this year, and I just had this image of us being in clinics all the time and just not feeling well. And we've got kids, our kids are 18 and 22, and you know, we still spend a lot of time with them. And we just wanted that life back, so.
Well, I was just tired all the time, and I was sluggish, and I just did not feel like myself at all. I just got to where I don't want to do anything. I mean, I didn't want to go anywhere. I mean, it was a drudge to go to the grocery store, and that's pretty pathetic.
I started out with a thyroid condition, and I had a lot of tiredness still, and we were going to a specialist at the time, and I kept complaining, and my husband kept seeing me on the couch and just listless, and so he decided to talk to his friend Todd.
Dr. Ferris.
Dr. Ferris, who had, his wife had went through some hormonal replacement therapy.
Many people think that the natural progression of age is to become debilitated, to put on weight, to become sexually inactive, to not be able to do many of the things we did when we were younger, and that does not have to occur.
As you grow older, your hormones stop putting out what they used to put out, and thus we begin to age. And with women, you know that based upon you start to go through menopause, or you can have surgery and have surgical menopause. And when you lose your ovaries, which secrete estrogen, testosterone, progesterone, your sex hormones, then everything starts to go downhill for a woman after that.
I had talked to my regular doctor about doing the hormone replacement therapy. Well, I don't think he really knows all that much about it, so he was kind of like, oh, you don't need to do that.
The beginning of bioidentical hormone replacement started back in the 30s and 40s. Why don't more doctors do this? I just think most of them aren't taught this in medical school. My partner, Dr. Blau, I asked him that question, and he says, well, they're taught by 60-year-old people that taught them, and it's just never changed. Most physicians were based on taking care of sick people, not keeping people well. So it's a paradigm shift. A lot of people ask, is replacing your hormones safe? And they'll ask me that question, and I'll say, well, it depends. If you replace them with synthetics, I don't think so, and the studies show that they're not. And if you replace them with bioidentical hormones, which is identical to what your body used to make, then it's safe. Synthetics are not safe, and the studies have proven that. And the Women's Health Initiative proved that in '04, and that set out the alarm to stop all hormones because these women were getting breast cancer due to taking synthetic hormones. And there were a lot of women that were like, I don't want to stop taking my hormones. They make me feel great. And there were some that were just, they'll run that risk. And what we're saying is like, oh my gosh, we've got something. And a lot of doctors in the US have bioidentical hormones, and that's what you need to use because they're much safer.
All right, I get it. I'll go to the Broadway clinic.
Lose that unwanted weight through a plan that combines diet, exercise, nutritional education, and proper medications under the supervision of a doctor. Lose the weight at the Broadway clinic.
In September, we started the HCG and the hormone therapy at the same time. Worked through it, did it together. We were determined, if we do this, we'll do it together. Yeah.
Do it together, and it helped both of us to be able to do it together.
We actually, like I said, we were cautiously optimistic. That's what we said, and you can eat yourself to death, or you can just ignore things. And if you ignore things, that's what leads to bigger things. And so we were just at the point where we don't want to ignore signs of we need some help, we need something, but we wanted to do it in a situation where We didn't want to buy anything on the internet. We wanted it to be precise. We wanted to have the blood work done. And we went and met Allison and all the girls there, and Dr. Blassie. They're just, you know, super people, and they care. Alice, you know, she checks that blood. They check every level. They told us why we're lacking in vitamin D and why we're lacking in all these different things. And age had very little to do with it. You know, the weight and age combination did.
And I went back in and they drew the blood, and I mean, my lab was like so messed up. It was like a wonder I was even doing anything. Basically, he did like a little physical kind of deal, and then he had me come back in like a week, and then that is when he started me on the medicine.
We thought we would try it out, so he tested my blood and then found out that my T cells weren't even being addressed. And he said, we also don't just go for the, just, what was it, the maximum? He wants to go to the, you know, your highest ultimate level of, so that you're not just feeling okay, that you're feeling fantastic.
I remember one of the things that he talked about was that a traditional doctor would want you to, you know, be what a 48, 49-year-old man would be and everything. And I said, well, he goes, you know, you don't want to be what a 49-year-old man is and everything. He goes, you want to be, you know, what, you know, a 30-year-old was.
We review your symptoms, and after we review the symptoms, we'll take some blood to do a blood test, and we'll test your levels of hormones. And this is very important to understand, because normal is not good enough. Normal just means that you fit within a very broad range that has been established for normal values. But do you want to be on the low end of normal, or do you want to be in the optimal range of normal? We restore your levels not just to normal, but we restore your levels to optimal ranges of hormones. We monitor those levels periodically with blood tests, as well as we listen to you and what your symptoms are. To me, it is more important how you feel than necessarily what a blood test value shows us, because it's you that I want to treat, not the lab number.
You know, you got to listen to the patient and get their symptoms. On the flip side of that, you need some objective things, and that's their blood work, and it'll show you what's going on, what hormones they're lacking in, and you kind of match those to their symptoms. And when we have that, then we basically run that by Janie, and so Janie makes those specific doses based upon what the patient's needs are.
The Broadway Clinic Pharmacy was opened in an effort to provide our patients in our clinic that come in specifically for bioidentical hormone replacement therapy. And in that effort, we can work directly with our doctors to make specific dosage forms and dosage strengths necessary to help them achieve their hormone goals that are discussed with their doctor in their program.
Broadway Clinic has their own pharmacy in there, but they don't just have a regular pharmacy, they have a compounding pharmacy. And that's what's so good about this type of hormone replacement therapy, because they compound, which means they put together each individual medicine for you and for your body. Because everybody, you know, most definitely, it's not a cure-all across the board and everybody just gets the same thing. It does not work like that at all.
We have the equipment and the skills and the education and training necessary to provide specific compounds. We put together chemicals, raw chemicals that are FDA approved, and put these together specifically for the patient. We do slow down a little bit and take more attention to our patients that come in the clinic. Everybody has a lot of time spent with the doctors and the providers up front, and a lot of care is taken in making sure that their medications are specific for them. Our compounding is done daily and continuously, where we always have it available, and we make sure that the patients are knowledgeable about their medications before they leave, and they understand what their goals are. Not to say that that doesn't happen in retail pharmacy, but there's a lot of hustle and bustle that goes on, and this is not just your count and pour, lick and stick a label on and get somebody in and out the door. We take pride in taking care of our patients and making sure they reach their goals.
Whoa! You have lost a lot of weight. What are you, dieting, exercising?
You want to know my secret?
Yeah.
I've been going to Broadway Clinic.
Now's the time to lose weight. The Broadway Clinic has various individual programs to accommodate your lifestyle. Real results from physicians with over 30 years experience.
Well, you keep it up because you look good.
Thanks.
Yeah, for a while there I thought you were gonna break me. I was like, whoa, here she comes, brace for impact.
Most people don't, they know something's not right, but they don't know this is what they need. And so they usually, it's word of mouth. And so what we're trying to do is educate the community. Hey, do you have these symptoms going on? You know, you're not sleeping well. You know, women, here's what happens to them. Can't sleep. Well, probably don't have the right level of progesterone anymore. You know, I have no energy. Well, you know, maybe your thyroid and testosterone's pretty low. You know, my skin's not looking good anymore. You know what? Probably don't have any estrogen anymore. And so if you can balance these, you just restore people's health and life. You know, it's really cool. And the same thing with men. We do that with testosterone. And that's what's fun is they just, so many of them just say, well, I thought I was just getting old. I said, well, you're having more birthdays, but that doesn't mean you necessarily need to be old. I mean, you can't live forever, but you know, this helps while you're living.
I feel much better. I have a ton more energy. I don't just want to lay on the couch and say boo-hoo. I think because I feel so much better and I don't act so scattered anymore in my thoughts and I'm not forgetting everything that they tell me, then it's just made our relationship with my sons a lot better.
I mean, we became believers. The first month we were like, whatever we do, we're doing that forever because it just changed everything.
Your mood is different. I mean, you're happy and you want to do things on the weekend and after work, and you're just not going to lie there like a lump. So it changed that. It changed our relationship. You know, we always worked out together, and I was like too tired to, so we're back to working out together and doing things together on the weekends and whatnot.
That was one of her major issues and everything, was that just frustration, and she was feeling that and sensing that and everything, and it's made a huge difference there too.
The energy level comes up and you're just all of a sudden, hey, I can remember things. I don't have to go to bed at 7 o'clock. Grow old together, not just, you know, exist.
I just feel like a new woman. And I feel like not 20, but I can say higher 20s. I'm not going to say my real age, but I feel a lot better.
A lot younger. It's our bodies don't have the aching and hurting like we had. The mental clarity, that's been a really big thing because I had lost a lot of mental clarity, and just it really helped me get that back.
When your kids come in and say, you look skinny.
I guess I never really realized how much that hormone replacement therapy would affect your thinking and the clearness, and I mean, I get the energy and you know, trying to do something about the weight. I get all of that, but I just did not realize that there would be such an emotional benefit from it.
You want to do things. You want to get out. You want to, whether you're a golfer or you're a workout or a jogger or whatever, you want to do it. It's not a drudge. It's not a, you know, something that you're just sitting there going, oh God, I got to do this. So that's the main thing. And then, you know, like I say, you know, I also enjoy our time together better. You know, we have a good time.
Yeah, and for me, it's like women say, oh, you're just going through that change and just, you know, endure it. And I go, why do you have to endure it when you have bio-identical hormones that can take care of that? There's no reason to endure that and have that pain.
We're proud of each other. We are very proud of each other. Just sticking to it and willing to try it, as opposed to, it probably won't work. And we got some friends, our older couple, they're in their 70s, and they're on it now, on the HCG, trying to lose weight because she has knee problems, back problems, all these things. And I've talked to my buddies. I said, man, you want to get your life back, get on that hormone therapy.